Children are, by nature, a rough and tumble lot who are exposed to their share of bumps, bruises, and illnesses. And as parents, we want to ensure their continued health and well-being with proper medical care. But one avenue to good health for children is often overlooked: pediatric chiropractic care.
There are 3 reasons why you would consider bringing your child in to see a chiropractor. The first is if your child is having certain symptoms. The second is for a preventative wellness checkup. And the third is for a newborn baby to have a structural examination to be sure they came through the birthing process okay.
See, Andrew, I'm gonna have you spread your arms out like this. There you go.
Dr. Elise Hewitt is a pediatric chiropractor who has been treating children for over 10 years at her Pediatric Chiropractic Center in Portland, Oregon. She sees children for a variety of symptoms.
There are certain conditions that respond well to chiropractic adjustments. These include things like colic, if your child is having trouble falling into a deep sleep, if your child wets the bed at night, if your child is fussy or cries a lot, if your child has chronic colds or chronic ear infections, if your child has constipation. These are all different conditions. Growing pains is another condition, and of course headaches and back pain are all conditions that respond well to chiropractic treatments.
So a little sore down here, Zach?
Zachary Hitchcock is a typical 3-year-old boy, but when he began to suffer from bouts of asthma, his mother Rachel decided to bring Zachary and his brothers in for examination by Dr. Hewitt.
He has had problems with asthma, and not an acute, not all the time, but once every month or so, every couple months. He was having trouble breathing, lots of allergies, and I thought, well, I think I'm going to try it. And it was such a positive experience. Like, they liked it, they were comfortable, and it didn't hurt them, and they showed such signs of improvement.
Dr. Hewitt believes in the value of both traditional medicine and chiropractic care for children and works closely with her patients' pediatricians.
It's very important that a child have both a pediatrician and a pediatric chiropractor. A pediatric chiropractor is not there to replace the role of the pediatrician. The pediatrician provides medications when necessary, is there for crisis care in times of serious illness and injury. A pediatric chiropractor is there for more preventative wellness care and maintenance of the child's structure. So the two are very complementary.
And pediatricians like Dr. Barbara Ferre agree.
There's so much that we don't know in traditional medicine about the body so far. I mean, we know a lot about biochemistry and a lot about antibiotics and all those things, but how the body is totally integrated with mind, muscles, everything is really important, and chiropractors have that expertise that traditional physicians do not.
You know what, you can just spread your arms out and just hug the table. There you go. Just let your body relax.
In addition to treating children for certain conditions, chiropractic care includes regular wellness checkups with special attention paid to the joints of the spine and cranium. Similar to the twice-yearly trip to the dentist to check for cavities, children should have regular examinations of the spine to ensure proper growth and development.
In young children, the spine grows about 50% in the first year of life, which is a tremendous amount compared to growth in future years. So any little structural problem in the spine during the first year gets magnified because of all the growth that occurs. So how's he been? How's he sleeping and eating?
The third component of chiropractic care for children is newborn checkups. Most babies come through the process of labor and delivery without a problem, but some end up with mechanical lesions from what is known as birth trauma.
The forces of the labor and delivery process get transmitted through the spine in a way that is not healthy for the baby. This can cause some of the joints in the spine to get locked up. And if the joints get locked up, it can interfere with the baby's nervous system, which then will cause a symptom in the baby, for example, colic.
Like their counterparts who treat adults, pediatric chiropractors complete a rigorous 4-year, 4,000-hour course of study. Dr. Ravid Raphael is a clinic director at Western States Chiropractic College in Portland.
Students take courses in pediatrics and pediatric adjusting as part of their undergraduate chiropractic course of study. However, some chiropractors choose to go on and specialize in chiropractic pediatrics and to study for a diplomate certification, a specialty certification in chiropractic pediatrics.
Chiropractors are trained to find and adjust problem areas in the spine and cranium called subluxations.
A subluxation is a joint between two bones, either two bones in your back, two bones in your head, it could even be two bones in your shoulder or your elbow, two bones that are not moving properly, or one bone that's not in the right place compared to the other bone.
Subluxations can affect children in two ways, either structurally, for example when a subluxation inhibits bone growth resulting in a scoliosis, or functionally, when a subluxation interferes with the function of the body.
If you have a subluxation somewhere, it can interfere with the function of the nerves in that area. Now if the nerve goes to a pain receptor, then you'll get pain. If the nerve goes to a muscle, then the subluxation will cause muscle spasm. If, however, the nerve goes to an organ instead of a muscle or pain receptor, like the stomach or the lungs or the bladder, then you will get dysfunction in that organ. Good job.
To remove subluxations and their symptoms, chiropractors use a technique called adjustments.
Bedwetting in a child can come from a subluxation in the low back interfering with the nerves that go to the bladder. The child can't feel the bladder properly and ends up wetting the bed because he can't feel that he has to go to the bathroom. You get adjusted, the subluxation goes away, the nerves to the bladder work properly, and the child has feeling now in the bladder and doesn't wet the bed anymore.
He's a typical little boy, likes to run and jump.
Elizabeth Morneau credits Dr. Hewitt's chiropractic treatment for helping her son Christopher.
He wasn't potty trained, and I thought, well, he's a boy, I'm not going to push this. And he was off in his pelvic area, and he was adjusted, and within a week he just put underwear on. That was it.
It's great how much of a difference it's made in her behavior and comfort level.
Bridget Towles had similar positive results with her daughter Kayla.
Kayla was having trouble latching on when she was nursing, or staying latched on when she was nursing. She seemed really uncomfortable, like her neck or her body hurt. I saw a change immediately, like that same day. She slept, I think she slept a lot the day of her first adjustment, but she was immediately nursing better.
One of the times I would recommend chiropractic care to Dr. Hewitt would be for babies that were having particular problems maintaining a latch.
Lori Ferdinand is a registered nurse and certified lactation consultant who recommends chiropractic care for some babies who have difficulties nursing.
Oftentimes we see when babies are born, they're pulled certain ways or their bodies are twisted at birth, which occur normally. And when this occurs, they seem to have difficulty moving or be in pain when they are nursing in a certain type of position. And by adjusting that, it seems to help them be more relaxed in that position.
If in a baby, the cranial bone interferes with the nerve that goes to the tongue, which is called the hypoglossal nerve, a small area of the tongue will go into spasm and the tongue won't be able to work right. So when the baby goes to suck, the baby won't be able to do the proper motion with its tongue. Now, a chiropractor will give a gentle adjustment, very gentle adjustment to that cranial bone, remove the interference with the nerve, the tongue can now work properly, the baby can suck normally.
After treatment, and this was like, well, the first treatment, Peyton would nurse both sides in under 10 minutes flat.
For Jane Boutwell, chiropractic adjustment not only helped her daughter Peyton to nurse, it also improved her sleeping habits.
For about the first, the first week, Peyton, our daughter, wasn't sleeping, but maybe on a good day, an hour at a time, and then she'd be up for 3 or 4 hours. And when it would come to nighttime, oh my gosh, it was miserable. And after the first couple of treatments, she started sleeping at 4 and 5 hour stretches.
Going to a chiropractor's office, at least a pediatric chiropractor's office, is usually a lot of fun. In my office I have books and toys for the kids to play with. I have Big Bird and Cookie Monster and Bert and Ernie up on the walls. I have mobiles hanging from the ceilings. It's really a fun place for the kids to be. I do a lot of the same initial workup exams that a pediatrician would do. I look in the ears and the eyes and listen to the heart and the lungs, those kinds of things. But as a chiropractor, I also pay special attention to the child's structure, to their spine and cranium. And now come on back up. Good. Now go
An exam by a pediatric chiropractor starts with a posture analysis to see if the child is properly aligned. Then the child lies on a special table for an examination of the back. The chiropractor also evaluates the motion and position of the neck bones, as well as the health of the soft tissues in the back and neck. If any subluxations are discovered during the exam, the child is adjusted using a number of different techniques.
How'd that feel?
Good.
Good. Children are much more flexible than adults. Their bones are not fully ossified. In other words, they're not fully turned into bone yet. And the ligaments that hold the bones together are much more elastic than they are in adults. So for all of those reasons, much less force is needed to do an adjustment on a child as compared to an adult. It's very gentle.
After the spine has been examined and treated, the cranial bones are evaluated. This procedure is both softer and quieter and starts by palpating the head to feel the motion of each of the individual bones of the cranium. Treating cranial subluxations is different than treating subluxations in the spine in that there is no quick adjustive motion or popping sound. In fact, treatment looks just like the examination. The result of this low-key approach is a positive experience for both the child and parent.
It was really interesting how gently she was adjusted, and she didn't fuss at all. She was actually pretty happy the whole time.
I was a little concerned because I thought maybe he wouldn't like it. He would be afraid. It would be hard on him, but it never was. He enjoys coming in here. He loves the doctor, and he thinks of it as a great experience.
Since getting adjusted, they just seem healthier and stronger and more even-toned emotionally. And it's such an amazing thing. Even I've started going.
It's the best thing I've ever done for him.
Many first-time parents are concerned about sending their child to a pediatric chiropractor because of a great number of misconceptions.
One of the biggest myths is that once you go to a chiropractor, you'll have to go for the rest of your life. And I like to liken our situation to that of a dentist, because a parent could say the same thing about taking their child to a dentist. Once I take my daughter to a dentist, she'll have to go for the rest of her life, which of course is true, but it's not because the dentist has done some irreparable harm to her teeth. It's because the dentist recognizes that an ounce of prevention is worth a pound of cure.
Yeah, right there.
Another frequently asked question is why more pediatricians don't recommend that their patients see a chiropractor.
I think in general, traditional physicians are a little wary of alternative health care. My feeling is that they're getting more and more comfortable with it, and there certainly is starting to be literature that documents that it's a part of medical care that has been previously unrecognized by traditional medicine.
Another big breath, and all.
Still another issue that keeps parents away from a chiropractor's office is the adjustment itself and how safe it is.
The adjustment is a very safe procedure. All healthcare practitioners carry what's called malpractice insurance to cover them in case they harm a patient. And the rates of malpractice insurance are set based upon the risk of the procedure. The higher the risk of the procedure, the higher the rates. And chiropractors have the lowest malpractice insurance rates of all the healthcare providers in this country.
Parents can evaluate their children at home to determine if their child needs to see a chiropractor. If the child is old enough to stand, a parent can look at the child from behind to evaluate her posture. Are her shoulders level? Are her hips level? If not, these may be signs of subluxations in the child's spine. If the child is still a baby, a parent can look to see if the baby favors turning his head to one side more than the other, if he reaches with one hand more, or if he crawls in an asymmetrical fashion. Any change in attitude, appetite, sleep, or bowel habits after a child has had an accident or a fall could also signal the presence of a subluxation. In addition, there are certain conditions that can provide a clue to parents that their child may need to see a chiropractor. These include a child who frequently gets ear infections or colds, a colicky or a fussy baby, a baby who won't or can't nurse properly, a baby who awakens frequently, a child with a bedwetting or constipation problem, a child with growing pains. As parents, we of course want our children to live healthy and happy lives, and seeing a pediatric chiropractor is an essential component of our children's health and well-being.